right, today we are going to demonstrate how to start an IV on a patient. First things we have to assess are their fluid status, their skin turgor. You want to check for edema in the extremities. You want to do maybe a set of vitals, check that blood pressure, check their urine output, their cap refill. We want to check for probably their most current lab values, just to make sure everything is okay. Lung sounds, we want to do those as well. Just do your normal, assessment on the patient. You also want to make sure that they aren't allergic to anything, especially things like latex or iodine, adhesives, things like that. And then we also want to check for bleeding tendencies. So things like the patient, any medical conditions that cause bleeding, or maybe medications such as warfarin, something like that. We want to make sure that we're aware of that before we start. We also need to check on the status of the veins. We want to make sure that we're not using an arm with an AV fistula, or the same side that they had previously had a mastectomy, something like that. We want to make sure we avoid that side at all costs. And we also want to check orders for fluids, medications, anything like that the provider has put in for us to infuse, because we need to know. That helps us also determine what size of IV catheter that we need to use. Typically, for most patients, we'll use a 22 gauge if possible. If for normal, that's what normal fluids and stuff run through. We want typically to have a larger bore catheter if we were going to be infusing blood products or something like that. So we always have to make sure we know what we're running. Also taking into consideration as well how long the IV is going to be in and stuff like that when we're assessing that site. So then we want to make sure that we have all of our supplies. We want to have our J-loop, making sure we have a PosiFlow, either one with a PosiFlow attached, or getting a PosiFlow to attach to it if it's not already. We need our IV start kit here. We want to grab a couple of our 22 gauge catheters, so we have an extra one just in case we need it. Alcohol wipes, stat lock, whatever your facility is going to be using. We want to make sure we have one of those too, anything that's going to be to stabilize that IV for us. And then also a one-time flush of normal saline, making sure we have that, and having our gloves and everything ready as well. Before we go ahead and get started, one thing that we could do is wrap the patient's arms with pack them with warm, moist heat, because that's going to help with vein dilation, and we can let that sit on there while we are getting our supplies ready, just to help us get an easier start. So we would also, before we would do that, we would let the client know what we're going to do. Tell Mr. Smith here that the doctor ordered some IV fluids, and we need to put an IV in there so we can get those started as soon as possible. And make sure we let the patient know as well, that it's just going to be a little stick. Just explain the procedure and how things are going to go, ensuring that the client is comfortable, or patient is comfortable. So then we're going to make sure that we're ready and have privacy. We're going to wash our hands, or hand sanitize. And while we would have those warm compresses there, we can go ahead and start getting our supplies ready. So we're going to check our expiration date on our IV kit, and on our J-loop, as well as our needles. We want to make sure that the dates are good there. Then we can go ahead and open up that IV start kit. And just kind of start setting things out, making sure that we have everything prepared and easy access for us. And we have tape here, so we're going to get a couple pieces of tape ready so that we can get that secured. And then put this over here to the side. And then open up our J-loop. We're going to make sure we have the cap off of that, keeping it in the package to maintain sterility as much as we can. We're going to take our flush. And we are going to make sure that we have all the air out of that, get that ready. And then we're going to take that and we're going to go ahead and connect that here. And we're going to flush through a little bit. We're going to prime that tubing, making sure that all the air and everything is out of there and that we're ready to go. And then we can put that off to the side here. And then from here, we are going to check the client's veins. This is when we're going to go ahead and decide which vein we're going to use. Trying to avoid the AC. We don't want to put one there because the client bending their arm and everything all the time. It can cause damage to that catheter in there and cause the IV to go bad sooner than necessary. We also want to try to avoid any veins on the hand. Use that kind of as your last choice because the veins there are the skin is thin and the veins are more superficial. So we want to try to avoid that if we can as well. We want to look for so we want to use the distal veins first, if at all possible, and also avoiding the dominant arm if we can, just to make things a little bit easier for the patient, because patient comfort and safety is always our number one priority. Again, we have already assessed for any fistulas or prior mastectomies, things like that, but we want to avoid any thin scarred veins or any that appear to be in poor condition. We don't want to use those. We want to use to find the straightest vein with the largest diameter. If the patient were possibly, had hairy arms and it was hard to visualize that, we could always use like a clippers or something to make that a more visible area for us. So the warm compresses, when we packed the vein before, packed the arm before, that should help with vein dilation. If that doesn't, then we can always have the patient pump their fist or use a blood pressure cuff possibly, only pumping that up to about 30 millimeters of mercury, because we want to prevent constriction of the arterial system. They also have vein finders that we can use if we're really having a hard time visualizing a vein. But we want to take our tourniquet here. And we want to place that about 6 to 8 inches above where we're going to be working. Pulling that nice and tight and making sure that we can have that easily, quickly released. And we're going to make sure we put our gloves on. And we have a towel or a pad, chucks underneath the arm just in case any fluid leaks. We want to make sure that we keep everything clean for the patient. So we have our tourniquet on there, and then we're going to palpate the veins, looking for a vein that's resilient, soft, and bouncy. And again, using those methods that we just talked about to, if we're having a hard time finding a good vein to use. So then after we found a good vein, this one looks like it's good. We're going to go ahead and release that tourniquet for right now with the patient's arm so we don't cut off any circulation there. And then we're going to take our ChloraPrep and we are going to scrub for about 30 seconds on that area, up and down motions, circular motions, just trying to use as much friction to get that area clean. And then we want to let that dry for 30 seconds. So while we're letting that dry, we want to make sure we reapply the tourniquet. We want to make sure that's about 4 to 8 inches then, I guess, then above the site. Again, pulling that tight and making sure we have it a quick release. So then we know where we're going to go. We're going to be careful not to really touch that area. So we are going to make sure we hold the skin taut. And I should have made sure that my needle was open here. So I'm going to use my non-dominant hand to anchor down that vein, pulling the skin taut, as I said. And then we are going to let the patient know it's going to be just a little stick, and using 15 to 30 degree angle, making sure that the bevel side is up on our needle. That's then when we can go ahead and insert the catheter into the vein, making sure we're checking for blood return. And then once we get that, then we can reduce the angle of the catheter until it's about flush with the skin before we start advancing it. Yeah. All right. Mr. Smith, just a little bit of a stick. Holding that taut. I'm going to go ahead and go in. Advancing that forward. Then we can go ahead and put pressure here, pull the tourniquet, stabilize that, and then we're going to go ahead and advance that, pull that out. And then we are going to go ahead and hook that up, stabilizing that. And then we are going to pull back, make sure we have blood return, which we do. And then we'll go ahead and flush that. Watching and making sure that we aren't having any fluid leaking in, making sure that everything's in the right place. We can go ahead and secure that there. Disconnect this. Then we would go ahead and take our alcohol wipe. Again, so observing for any swelling or anything in this area, making sure we have everything in the right place. Securing with our stabilization device. Right now we're just going to use tape. And maybe I should go back a step, and we're going to take this Tegaderm here. And we are going to make sure we cover that. There. And also making sure that we're going to loop this and secure it so that it's not dangling everywhere. We don't want the patient to accidentally get pulled on anything or get that pulled out because that would be highly uncomfortable. And then we would make sure that we take that alcohol wipe and alcohol off for 30 seconds. And then if the patient had IV fluids running, that's when we would go ahead and connect that. And from there, then we just need to clean up all of our supplies and everything like that. Once we know everything is good, clean everything up, make sure we're disposing of our sharps in the sharps container. And then we would go take our gloves off, wash our hands, go into Epic, and make sure that we document the site that we put that IV in, the dressing that was put on there, fluids that are running, the gauge of the needle that we used, how the patient tolerated getting the IV put in. We are going to make sure the patient's comfortable, and we just document everything that we did. And that is about it.